What differentiates the University of Arkansas for Medical Sciences from other healthcare facilities in the state? One of the nation's leading cancer treatment centers, with the world's largest center for multiple myeloma, a cancer of plasma cells, and more than 1,200 clinical trials. The UAMS Winthrop P. Rockefeller Cancer Institute aspires to apply for National Cancer Institute, or NCI, designation. This prestigious designation is awarded through a highly competitive assessment process. The Cancer Institute reports about 140,000 patient visits each year. A majority of patients come from throughout Arkansas and the southern region of the United States. There are 69 NCI-designated cancer centers in the United States, with the closest being in Memphis, providing only pediatric care, then Dallas, St. Louis, and Nashville. NCI designation will provide Arkansas cancer patients with vital options: improved access to clinical trials and new therapies unavailable elsewhere in the state, expanded services through greater access to public and private research grants and other funding, and the expansion of Arkansas as a healthcare destination through national recognition as a top-tier cancer center.
To be designated by the National Cancer Institute means that a cancer center has met certain rigid criteria and has undergone strict peer review to get this designation status. The designation process itself is strictly about research infrastructure and our ability to translate discoveries from bench to bedside and deliver new cancer therapies to patients. Right now, we're in a position that we meet most of those criteria. The final mark that we need to meet is we have to get our grant funding up to about 18 to 20 million annually in cancer-related grants. We're very close to that right now, but we need to recruit additional research scientists to get up to that grant goal.
Receiving the NCI designation would place UAMS among the top 4% of the approximately 1,500 cancer centers in the United States.
I was diagnosed with a small, non-invasive breast cancer, but I went to the radiation oncologist in Hot Springs and he said I would have to have my pacemaker moved since the cancer was directly underneath it. And I went back to my cardiologist and he said, I can't move your pacemaker. He said, it's too dangerous, it's too risky. He says, you need to go back to your oncologist, which I did. And then they decided that maybe they should just go ahead and do a mastectomy to be on the safe side. So then I ended up at the surgeon's office and he said, I am not going to cut off your breast for such a small cancer. I'm going to send you to UAMS. They can take care of you, which they did. They are tremendous. They make you feel right at home. They take very good care of you. They explain everything to you and you just become kind of part of the family. And I think a clinical trial is a critical part of any kind of treatment, be it a cancer treatment or any type of drug therapy or immunotherapy or whatever. But I think it's very, very important.
UAMS being the only academic medical center and the only academic cancer center in the state of Arkansas, we are the only ones that are ever going to be able to achieve this NCI designation status. And so we think that this is a big mark that the state can achieve and can be proud of.
Our mission is to improve the health, care, and well-being of Arkansans and others in the region, nation, and the world. UAMS, for a better state of health.